For the millions of people living with diabetes, just managing blood sugar is only part of the story. There's this really common, often debilitating complication that we don't always talk about: nerve damage. So today, we're going to dive into a massive new review that pulls together all the latest science on how we find and treat this condition, which is called diabetic neuropathy. Let's see what it tells us.
So just how common are we talking about? Well, the scale is pretty staggering. This review confirms that up to half of all people with diabetes are likely to develop some form of nerve damage over time. That is a huge number, and it makes understanding this condition absolutely critical.
So what exactly is diabetic neuropathy? Well, it isn't just one single thing. Think of it more as a whole family of disorders that damage the peripheral nervous system. And this damage can show up in a bunch of ways, anything from some tingling and numbness all the way to severe chronic pain that can really impact a person's quality of life.
Okay, so to get to the real truth of what actually works, the authors of this review did something pretty incredible. They started with over 8,300 studies, and then they had to filter all of that down to just the 76 most rigorous, most relevant clinical trials from the last 5 years. It's that intense focus that gives their conclusions so much weight.
So, first stop on our journey, diagnosis. How do doctors even begin to identify a condition that can be so different from person to person, and sometimes feel totally invisible? Well, the review gives us a really clear look at the modern diagnostic toolkit.
The review confirms that, the gold standard is still something called nerve conduction studies, which basically measure how fast electrical signals are zipping through your nerves. But what's really exciting is the rise of some powerful new tools. We're seeing more of these handy point-of-care devices for quicker screening, and even emerging blood biomarkers like HGF and VEGF-A that might one day help predict how severe the neuropathy is.
All right, so once it's diagnosed, what can we actually do about it? This brings us right to the heart of the review, a really comprehensive look at the entire treatment landscape as it stands today.
And this, right here, just shows how diverse the strategies are. We are not talking about a single magic pill. The research covers this huge range, from targeted pain meds and neurostimulants, all the way over to physical activity and really advanced therapies for complications like foot ulcers.
So let's start with what the evidence says is most consistently effective for those painful symptoms. These are the go-to medications, the first line of defense that doctors are most likely to reach for.
The two medications that really stand out with the strongest evidence are pregabalin and duloxetine. They both offer a pretty similar, meaningful reduction in pain, but they each have their own little superpower. Pregabalin was shown to significantly improve sleep, which is a huge deal for anyone in chronic pain, while duloxetine has a really well-established and acceptable safety profile.
But just managing pain is only one piece of the puzzle. What about therapies that might actually help the nerves themselves? The review highlights a therapy that shows real promise, not just for symptoms, but for the nerves themselves.
This number represents a direct boost in nerve function. What the review found was that alpha-lipoic acid, which is an antioxidant, was actually able to increase nerve conduction velocity, the speed of the nerve signal, by an average of 3.8 meters per second. That is a real, measurable improvement in how well those nerves are actually working.
But what happens when the standard medications just aren't cutting it? For people with that severe, stubborn pain, what doctors call refractory pain, the review points to a pretty high-tech solution that is gaining a lot of ground.
Okay, this is the key takeaway. Patients who were treated with high-frequency spinal cord stimulation, or SCS, were 2.4 times more likely to get at least 50% pain relief compared to those who just stuck with conventional medical treatment. I mean, that's a potential game changer for people dealing with the absolute worst of this pain.
But treatment isn't just about what your doctor prescribes, right? The review places a huge emphasis on the critical role of approaches that go way beyond the prescription pad.
Now, this might look like a small number, but when you think about mobility and safety, it is massive. Structured exercise programs were shown to improve average walking speed by 0.12 meters per second, and that translates directly to better balance and, crucially, a lower risk of falling.
And what's so great about this is that effective rehab is becoming way more accessible. The studies they looked at covered a whole range of things, from supervised balance training and high-tech anti-gravity treadmills to really effective web-based and home-based programs that people can do on their own time.
All right, so for our final section, let's look ahead. What does the research horizon look like? This review gives us a pretty fascinating peek into what the future of neuropathy care might hold.
there is so much exciting work happening. We're seeing consistent, if modest, pain reduction from things like acupuncture. There are early-phase trials for biologics, like gene and cell therapies, that are actually aiming for nerve repair. And down the pipeline, there are brand-new non-opioid drugs and advanced bioengineered materials that are totally changing the game for wound care.
You know, if there's one single message to take away from this entire massive review, it's this quote right here from the authors themselves. The best approach isn't a single magic bullet. It just isn't. The most effective care is one that integrates everything, medication, advanced devices, and those crucial lifestyle and rehab strategies, all into one cohesive plan.
And that really leaves us with a final thought to chew on. When you look at this whole complex web of effective treatments, from pills and spinal stimulators to exercise and even gene therapy, it really makes you wonder, is the search for a single one-size-fits-all cure the right path? Or is the true future of medicine really about building a perfectly personalized toolkit of therapies for every single patient?